Hi, I'm Dr. Chris Ward with the Dental Implant Center of Oklahoma. One of the questions that we get from patients that are calling in a lot of times is, tell me about dental implants. What type of dental implants are there? Which is better for me, and what indication and what situation? And the best way to answer that is there's probably 4 or 5 that are used in implant dentistry that we use to reconstruct the base for teeth to be made so that you can function normally and look beautiful and all the things that our goals are. The most common is an endodontis implant. Those implants are cylindrical. They have exterior screws, channels, so that when you put it into the bone, kind of gives it what we call primary stability or some fixation to the bone so that it's solid the day that it's placed. What happens over time is the bone is broken down as part of the bone metabolic process, where it gets soft for about the period of 4 to 8 weeks is when it's the softest after surgery. And then the bone begins to mineralize and get hard and change from osteoid, which is a softer material, to bone again. Once that happens, now you have where the bone is physically grown to it, it's solid, and you can start loading, or it can handle mechanical stresses. Those endosseous implants also have interior hole diameters so that a screw can be threaded down into the implant so that we can hold components to those. Those are the most common implants that we see in general dentistry. There's other options. Some of the ones that you hear about are mini implants. Typically the diameters are 1.8 millimeters or less. They're one piece typically. Those implants are used typically for temporary type situations. Sometimes they're used to help hold a denture down. They are a good solution when price is a big component. The downside for us when we see that is most of the time they end up getting loose, or they just unscrew or fall out. There's not a lot of surface area there for the bone to physically grow to. And it can be 10 years later and I'm going into a situation where I'm literally just unscrewing the implant. The bone never grew to it. And so the mini implants have an indication, but typically it's a temporary indication in our practice. Then you start looking at more complex type dental implants, whether it's the zygoma implant or the pterygoid implant. Those implants are used for the upper jaw, and it's a situation where the upper jaw is pretty much non-existent. Where the bone used to be that held the teeth in place, that bone's gone. And so now we have to figure out what can we anchor the teeth to that gives us a chance for you to chew and function normally. One of those is used on the inside of the cheekbone. It's still an intraoral approach. Typically there's 2 put on each side, and it helps stabilize that denture, and so it gives you a fixed solution. The other option is with pterygoids, which is a bone towards the back of the upper jaw. We can anchor when there's longer teeth or more teeth involved. We can cantilever that back to that area, and we can give it rigid fixation using that bone. When you deal with the lower jaw, once you've really lost the majority of the bone, it gets a lot more complex. There's subperiosteal implants, where those implants, basically, those games have changed. We used to have to try and take impressions, literally with impression material, of the bone itself, and then try and manufacture something that fit to the bone as precisely as possible. And then it's screwed into the bone in different areas, and it has little pillars that come up that then we can attach the teeth to. Anymore with CADCAM and some things with the CT machines that we have and stereolithic models, things that we can do, we can actually fabricate those just from the radiographs and x-rays that have been taken. So that's a little bit less invasive, but those are not done that often, but they are options for people. So there's lots of different types of dental implants. I hope this is helpful for you. If you need anything, please give us a call at the Dental Implant Center, 918-906-2525. Thanks.